Kande! Kande!
How's everybody doing? Thank you so much. I only have a couple minutes, so I do want to say, though, unequivocally, that I do support HR 676 single payer.
That's smart.
I do believe that healthcare is a right. It should be a right for every citizen in this country, and not a privilege. And you know, this healthcare bill that passed recently, which I supported, but I would have liked to have seen a public option, quite frankly, because that is what would have kept. Public option would have kept the insurance industry honest, and I think that would have gone a long ways in lowering healthcare costs. But as was mentioned, you know, I'm running for Congress in the 8th Congressional District against a guy named Mike Rogers, who, as a Congressman John Conyers noted, voted against healthcare legislation. I'm much more interested in hearing from all of you, and so I'm going to keep it short, as I said. I want to go to the next segment of this forum, which is the question and answer portion. But I spent the last 4 years working at Independence Blue Cross in Philadelphia, and so I have a unique insight into the healthcare legislation, or healthcare debate, because I was on the inside. Blue Cross had 250,000 members, 7,000 employees, revenues over $9 billion a year. So I was doing budgeting, forecasting, profitability analysis, financial modeling, and the other important thing that I was doing is contract negotiations. And so I negotiated contracts for many different types of plans, whether it was PPO, HMO, fee-for-service. I did all that in the last 4 years that I was there. And I have to say, unfortunately, I did see people who are members, who quite frankly who got sick, and who at some point in time, their claims started outpacing their revenues. And when I say revenues, I'm talking about the revenues that we get from members and premiums. And I've seen people, policies get canceled because of that, which is unfortunate. But that isn't going to happen anymore with this healthcare legislation. So that's something we have to be proud of. And I think the other important thing is, you know, now that this healthcare bill is passed, and this has been noted by some of our panelists, you know, the next phase of this is implementation. I think that's going to be important. We have to make sure that everything that was promised to all individuals in this bill, that everybody, all the citizens of this country and the state particularly, that they realize those benefits that was promised to them in this healthcare legislation. And so implementation is important, and that's why, with my experience in healthcare, being in Congress, I'm going to be able to help to work closely with Congressman Conyers to make sure that this bill is properly enacted. And I have a proposal that I'm going to mention real quickly. John Freeman talked about health insurance exchanges. These are supposed to be set up to go live in 2014. With my experience in healthcare, I know that the industry has the ability to do this faster, to set up these exchanges so individuals can go into these markets and purchase insurance at a group rate. And so my proposal, this is going to be my first first bill I'm going to sponsor in Congress, which is to move the insurance exchanges from 2014 to January 1 of 2012. And so we're going to make that happen. And so with that, I'm going to close. And again, thank you for having me here. This isn't my district. This is Natalie. We need to make sure that we get her into Congress. We get rid of Congress. We need Natalie. And so I'm going to work closely with you next year with the Secretary of Congress, and obviously we're going to have Chairman Conyers, who's going to be very helpful in terms of getting us up to speed in Congress, and we're going to make sure that again, this bill is properly enacted, and every citizen in this state and this country can realize the benefits of the healthcare legislation. Thank you. In my experience at Blue Cross, when I was doing contract negotiations, we signed 3-year contracts with groups. And in the first year, let's say, if you have 50,000 members, and we determine that the price is going to be, let's say, $30 per member per month, if the next year, if they increase their membership to 100,000, the price goes down because you have economies of scale. And I think what's going to happen is, this is going to work out for both
individuals and the insurance companies, because the more people that are covered, and I think the cost is going to be spread across the board, and so therefore it's going to bring down prices. And so there's not going to be a need for Blue Cross or any other insurance company, Aetna or whoever, to jack up their prices, because there'll be more people in the market.